Hey everyone, Dr. Sonal here. Let's talk about radiocontrast media reactions. I just had a patient that was referred to me yesterday because of a possible radiocontrast media reaction, and actually she was referred by the receptionist when she was trying to schedule an appointment for a CT scan, which also freaked out the patient because why is the receptionist giving medical advice, telling the patient, oh my God, you have to go get tested. You might have to take premedications before your procedure that you have scheduled. So what happened was this patient with a previous CT scan with contrast, shortly after the procedure was done, had some nausea and some palpitations. These symptoms self-resolved, did not need any treatment, did not go to the urgent care. No hives, no angioedema, no respiratory difficulty, no actual vomiting, right? So is that really an allergic reaction? Is this really an immediate hypersensitivity reaction? So again, history is going to be of paramount importance here. A few things to keep in mind. Most radiocontrast media reactions are not IgE mediated. While they may be immediate hypersensitivity reaction, a lot of this has to do with direct mast cell degranulation. So it's not IgE mediated, meaning most of the time I'm not going to be able to test for this via a skin test. So it gets a little bit complicated. Previously, for patients who had radiocontrast media reactions, they would require premedication with steroids and Benadryl. There was a whole protocol, 13 hours, 7 hours, 1 hour before. The newer research and newer recommendations just released last year actually state that very few of these patients are actually going to need premedication, only if they have had a history of severe reaction. There's a lot of patients that have mild or moderate reactions, but only severe reactions, and only some of those may require premedication because actually doing the steroids can cause more harm than actually good. Some other risks for radiocontrast media reaction: if they've had a previous history of radiocontrast media reaction, if you're female, if you have other history of atopy, these may be slightly increased risk of reactions to radiocontrast media reactions. Has nothing to do with shellfish allergy, has nothing to do with an iodine allergy. People can't actually be allergic to iodine. It's a natural substance found in your body. So again, no relationship to shellfish or iodine allergy. You'd be surprised. Even in this day and age, some radiology forms still have that written. So again, misnomer, a myth there. So if a patient may have a true reaction or sensitivity, if I'm going to skin test them, I need to know exactly what radiocontrast media reagent was used. There's different types of radiocontrast media that are used at different facilities for different types of procedures. I don't stock these in my office. I'm going to need the radiologist to provide this for me so that I could skin test the patient. So there's a whole lot of complexities that go on here. And most of the time, if you could use a different agent, or if you could use a lower osmolality agent, you're going to avoid some of these problems. So take a look at the information down below for more information. Let me know what questions you have. Again, let's bust those myths. Let's learn what you need to learn so you're not doing something, even though it may seem harmless to premedicate with Benadryl and prednisone, it can actually cause harm. So let's think about what we're actually doing. And I'm glad that some of these older guidelines are being, updated. Dr. Sonal here, board certified allergist.